Okay, so before starting with the session, for the benefit of the newcomers who have joined us with this webinar, so I would like to take you all through the quick introduction about us. So what is actually Skills for Med? We have been established since the year 2018. We're majorly focusing on the nursing professionals, like by designing them the comprehensive training program and to enhance the capabilities. So far now, like we have 10,000 plus nurses who have got benefited out of our sessions, and we have launched 25 plus courses, and we have enrolled with 35 plus hospitals. So you would have been seeing this pyramid, so where it is there in front of the Skills for Med. So what is that actually that logo speaks of? So it has stage wise learning for the professionals. The stage one is about the service excellence skills. So to pitch in the hospital to start a profession as a healthcare professional, you should know some basic things, which is for example, we're focusing on professionalism, communication, and about the infection prevention basics. And in the stage two, you're all now ready with the service excellence skills. So stage two, you will be focusing on core patient care skills, which is majorly focusing on the bedside procedures. You would have been heard a term called you're competent in one no procedure, you're very competent, like all those things. But putting up all the competency together after the stage of training, you will be becoming a clinical expert. And in the stage three, which we are talking about the specialization skills, you have become a clinical expert. Now it's not an end, you have to deep root yourself into your specialization, and that is, for example, upskilling yourself in the labor room or in the ER or in the critical care, or else as a clinical instructor. So that is another zone. So where after this you will become a specialized nurse. After that, it have not come to an end, and again you will be focusing on your growth into the leadership level. That is in stage 4. So into this leadership, something interesting, you have two paths. One is about the path towards the nursing leadership, another the path towards the nursing management. What is that actually? The nursing leadership, it is about the vertical path. Obviously, everybody want to become a nurse and focusing towards to goal to achieve the CNO post. And nursing management is something is like you will have a lateral path, which is like your goal would be into the hospital administration role. So this is about the skills for med learning pyramid speaks about. And here is an announcement. This is the infection control nurse course program. And this is the skills for med collaborative with Kaho, and it's a self-paced learning. Here is a discount which is running. The course which is of special offer is running. 24,000 course is available now in 17,700. The course highlights are comprehensive. We have seen many nurses who have taken up this course who had a real transition from the bedside as an infection control nurse. And like this, to know more about our course details, you can contact the number in the display. She is Miss Jayanti, our admin manager, and you also can visit our website, which is www.skillsformed.com. Okay, we have come, so we are going to start the session. Before that, a really interesting question here. So I wanted you all to show the emoji thumbs up. Okay, I think everybody knows that already. I can see the emojis running on the screen. So this is the question: how many of you had a needle stick? Even if you not reported it, show if yes. Oh my God, yes. A lot of thumbs up are running. Yes. Okay. So honest reply. So happy to see a lot of thumbs up. It's very important to report an incident. So this is like merely like, so brave to show that thumbs up. Yeah. Yes. Thank you so much.
Seem to be going on and on.
Yes. Yeah. Thank you so much. Thank you so much for your prompt response. Okay. So let's begin with the session. So today's topic is about workplace safety for nurses, preventing needle stick injury and infection hazards. You can keep going on giving the thumbs up until I give this introduction about Pari sir. So we are delighted to welcome you, sir, a highly respected consultant surgeon and the visionary founder for Skills for Med, a platform dedicated to empowering nurses and healthcare professionals, as we are giving the introduction about our Skills for Med. and he is a passionate advocate for healthcare quality. Dr. Parivalvan plays a key role in the CAHO. He contributes as a mentor, national speaker, GC committee member, and serves as a chair of EndoSafe, actively promoting endoscopy safety across India. So his leadership is deeply rooted in extensive clinical experience and ongoing research and international presentation. Through Skills for Med, he continues to advance healthcare outcomes by equipping professionals with real-world skills and practical knowledge. So Dr. Parivalvan, he is a unique blend of clinical skill, academic rigor, and system-level thinking makes him an inspiration and change maker in today's healthcare setting. So welcome you, sir, and it's all yours now.
Thank you so much, Stella, for that introduction. I don't know how many of the thumbs up was for me or for the needle sticking.
I think for the both.
Okay.
Yes. So do you want to continue the presentation
Yeah.
or do you want to
And,
change the slides?
can I share?
Yes, sure, sir.
Thank you. Can you see my presentation now?
I think transition is happening, so we can still see the previous presentation, sir.
On. Yeah.
Yes, sir.
Yeah, just 1 minute. Okay, you're able to see it in full screen mode?
Yeah, yes, sir. Please go ahead.
Yeah. So, good afternoon, everyone. Welcome to this special Friday webinar, which is, thanks to Shulke, we are able to, do this. And also, it has resulted in an enormous, interest in our webinars. We regularly cross the limit of 500 in the Zoom, and then there are a lot of people watching us now on the YouTube live. So thank you so much for all of you to making the time and coming and attending this Friday webinars. Thank you so much. So today's focus, as you already know, is about needle stick injuries. So I just want to set the stage by talking about the real impact of needle stick injuries. What are the clinical impact? What is the emotional impact to the people who get these injuries and the financial impact both to the individual and to the hospital? And also just look at what are the prevention strategies that really work, whether it is smarter devices or safer behavior or systems which support these two. And how do we empower every nurse? Now, because nurses are the most affected by needle stick injury, to move from fear to zero injuries. As you saw in the poll which Stella did, almost every one of us who work with patients, myself included, have had needle stick injuries in the past. So this is something which happens, and instead of taking it as a regular everyday occurrence, how do we make sure that we make sure that nobody gets needle stick injuries? So that is the focus of my talk. So I would start with this particular frame, which I thought was very nicely made. So achieve zero injuries with safer behavior. So I'm talking about safer behavior because ultimately, in the end of my talk, you'll realize why this is so important. So this nurse had one needle stick injury, and she had to wait for 3 months before the HIV serology came. So you can imagine what is the stress, and many of us have gone through this stress. Now, when you send the wait for the serology of the patient to come, now before you know whether you actually got the the problem. So that hurried step, without concentrating on what we are doing, leads to a lot of emotional upheavals. So, how big is the problem? There are several studies, and this one from India shows that almost one third, 31% of Indian healthcare workers get more than one needle stick injury a year. This is a real problem, isn't it? I mean, 1%, almost one third of healthcare workers getting affected by needle stick injury is really a very deep problem. But the deeper problem is what that study told, that 50% of NSI go unreported. So if you can imagine that 31% itself is high, and almost if you have 10 needle stick injuries happening, 5 of them don't get reported. So I don't know what the real data is as far as India is concerned. And as I told you, more than half of these needle stick injuries, or less than half of these needle stick injuries, 47% happen to nurses. So the first lesson that I want to draw from this is we need to report and we need to log. So unless we log, we can't fix this problem. Unless we know that how enormous it is, then we really don't know. It is like, we are hiding the problem under the table and not really looking at it. So this is the first lesson that we need to learn from this data, that all of us need to report and all of us have to have the data for each and every hospital on needle stick injuries. Now, I think this is very well known that hepatitis B virus is the most common infectious agent that gets spread by needle stick injuries, 30%, and hepatitis C is about 2%, and HIV is almost less than 1%. So that is the international data. And when I talk about effects, there are both the cost and the emotional toll. So when we read papers from the West, they quote very high figures. So when we convert it into Indian rupees, when that is, it roughly goes from about 50,000 to more than 3.5 to 3.6 lakhs. Whereas the one study which looked at the cost in the Indian scenario only took into account the lab cost. So how much does the lab testing of serology cost? And they quoted in this study that about 2,500 rupees. But people just mention superficially about the emotional toll. They say that 40% of the affected report anxiety, lack of sleep, and distress. But really, none of us have a quantification of the amount of emotional toll that this injury does to our workforce. So I just want to concentrate a little bit on the cause, because again, Vidya is here from the corporate office, and she would probably have a better look at this. So lab only cost in from India quoted at 2,500 rupees, but lost wages if the staff takes leave for follow-up or treatment. Now that cost is for the individual. We really don't know how much that cost is. And then absenteeism related cost to the hospital, the impact of staffing, getting extra staff, patient care getting affected, that again, nobody knows how much that will cost. And if the incident leads to any claims of dispute, there are legal expenses. And finally, the cost of psychological support or counseling is something which we can never put a ballpark figure on. It's a very, very subjective thing. So, this is what I call the hidden rupee drain. So, every needle stick injury on the surface looks like it is not much, the lab cost, if you look at it. But the real cost is much, much more, probably 10x times that particular cost. So this is something which we need to take into account. So remember that the true cost rises because of lost shifts, overtime, and staff replacement. So the next excuse everybody tells is, why don't you not recap, or why don't you use the one hand recapping? The usual thing is, it is, no, I don't have the time to do it. Now, as this video will show, the one hand recapping takes only 3 seconds. Okay, so look at these steps. All you got to do is put the needle into the cap, raise it up, and then with your thumb just press that cap onto it. Don't use your non-dominant hand. That is the problem why they say no recapping. So, unfortunately, in India, no recapping sometimes doesn't make economic sense. Many of us, of our patients, cannot afford the treatment, and we try to cut costs on various other things. So, having devices that have safety device, I mean, having needles that have safety devices are expensive. So, therefore, this behavioral change of one-handed recapping can actually save a lot of needle stick injuries, but even this is not widely taught and not widely recognized. So, to the extent that is the reason we are getting so much of needle stick injury. So, recapping is the major cause of needle stick injury, 30%. And the other important cause, which most of us ignore, we only talk about recapping, but having a disposal bin at arm's reach is very, very important. Your tray, which you're taking to the bedside, should have a mini puncture proof container so that you don't actually handle the needle twice. So, as soon as you finish the job, the needle should be inside the bin. So, this is something which every hospital should think of implementing. So, having a sharps bin in every injection tray, in every IV tray, cuts the injection and almost by 70%. So, these two are the important preventive things. Recapping, avoiding, and having a sharp disposal bill which is not more than at the arm's length. So, when you look at the evidence, you can make a summary that there are three things which give protection. One I already told you, that is the behavior. The other are the safety devices. Most of these evidence comes from the West, and they are promoting these safety devices. So the safety devices are 18 to 49%. Now, I'm not against safety devices, don't take me wrong. If your hospital can afford it, and if your patients can afford it, please go for safety devices. They, as you can see, they reduce it as much as 50%. The behavior, again, another 50%. Now, this is just for the interns. This study looked at just interns, and when they did, giving the teaching about the behavior change, that halved the needle stick injuries. And needle stick regulations. Many of the Western countries have regulations that if you don't do needle stick injuries, you're actually not obeying the law. So this cut by 22%. But now, after about 10 to 15 years of those legislations being in place, the benefit is plateaued. So the legislations only work to a certain extent. So behavioral change is the most important, and here is one reason why it doesn't work. It's goes by the acronym COMB. What is this COMB? So C is the capability. Okay, you should have the capability to know how to do one hand recapping or how to use the safety device. So, but there is very scarce hands-on practice on this. People are not even aware of, or capable of these two small, habits or skills which can prevent needle stick injury. The O in that is the opportunity. So when you have distant bins and workload pressure, then the opportunity of the safe practice goes down. So that's the reason I said we need to have the bins at arm's length, and of course workload pressure, there is very little we can do about it. The M is the motivation. Many of us think that this is something which does not happen to me. I am very safe. No, it doesn't happen to me till it happens to you. Okay, I was also thinking like that, right? So this behavioral change, that it can happen to me, I have to be vigilant all the time, is another important behavior change we need to make. And finally, the role models. When the seniors do two hand recapping, when they're careless, then the juniors catch those behaviors. So these three, when you talk about behavioral change, you need to do a combination of all these four. You need to give them capability. You need to make sure the opportunity for needle stick injury comes down as much as possible by keeping the bins nearer, by reducing the workload pressure, by motivating them and making them believe that it can happen to them. And finally, having good role models who practice it day in and day out at the bedside. But it is very hard. Behavioral change is the hardest thing, as you know, for any aspect of change, but this is the one which is going to work in the long term. And no safety devices, I already talked about. No, almost half the needle stick injuries. So another thing is also even the safety devices. There are nurses who have still got the needle stick injury because they use the non-dominant hand to activate the safety device. So again, the safety devices have to be activated only with the same no hand which you use the needle, so that you don't get the injury. So whatever is the device, now your behavior is also important. So for behavioral changes, we need to do skills drills, keep micro videos. This is one study which showed that both these things, and these drills need not be very long. They just you just take a 5-minute break from work and do these drills. And also these micro videos are like YouTube Shorts or Instagram Reels, and these increased shield use by 35%. Point of care bends, I already told you, reduces recapping by 70% because you can just throw the needle straight without recapping. And small reminders and rewards to people who consistently have no needle stick injury for the past 1 year. No, celebrate them. No, bring them onto stage and no, and then show them that as role models. And then we need to have safety champions that model best practices. So all these four type of activities help to change the behavior, and we need to do this. So here is a picture where in the ward, so once you have that particular time, no reminder comes to your phone, and there is a QR code, and using the QR code you can watch a small micro video, and then there is a small table in the nursing station where this drill about one-handed recapping or a safety device use is demonstrated to the nurses. It hardly takes 5 minutes. Okay, so that's something which all of us can implement. So legislation, the US Act has been shown that it reduces almost one-third in the first 3 years, and then it started plateauing. In India, NABH is insisting biomedical rules exist, but at the bedside it is not enforced. So I want to say that the law can set the flow, but it is the behavior which lifts the ceiling. Now, if you want to really reduce our incidence of needle stick injury, that ceiling can be raised only by each and one of us changing our behavior. So risk mitigation hierarchy, those who have studied risk management will be very much familiar with that. The most effective is elimination. So many needle-free IV connectors are now available. So please make use of that. And then substitution with blunt suture needles in the surgical area. Engineering, that is the safety syringes and arm reach bins. And then these administrative things like no recap policy and all those things. And finally, wearing gloves is the least effective. So this is the hierarchy of risk mitigation for needle stick injury. So when you talk about zero injury, how can I do that? Now you can put this as a poster in every ward. Stop recapping or at least use one-handed recapping. Click that safety shield. Drop the sharp immediately and report every stick. So you keep doing this again and again. Hopefully the needle stick injuries will come down. Finally, I'll leave you with my message before Ms. Vidya takes over. Every needle stick injury is preventable. All of us know that. After getting the needle stick injury, you think, my, if I just had concentrated on that particular minute, I wouldn't have concentrated. I got distracted. I used my non-dominant hand. You know that it could be preventable, but it still happens. And it is the only thing that will help the devices and policies which are in place is our behavior. Okay, so with this message, I now will ask Stella to introduce our guest speaker.
Sure, sir. Sure.
Yeah.
Yes. Yes. So We are so honored to welcome Ms. Vidyamani, Manager Corporate Operations at Apollo Hospitals, and she have completed her masters in Hospital and Healthcare System Management and Human Resource Management, and she is also a certified professional in healthcare quality. So she previously led quality initiatives at several leading multi-specialty hospitals in Chennai, including as head of quality at Apollo Proton Cancer Center. And she is a governing council member of Kaho Quality's professional wing and a certified qualitist from Pimpro Foundation. She is recognized as a distinguished alumni by Sri Ramachandra Medical College. Her areas of expertise include process improvement, operational efficiency, accreditation, standards, and patient safety. Please, join us, everybody, in welcoming Ms. Vidyamani. It's all yours here, ma'am.
Thanks, Stella. Thank you. Before I begin, let me thank Pari sir and the team Skills for Med, and of course Shulke team, Rajaram sir and Ganesh sir, who had reached out to me to be part of this program. I'm really humbled to be part of this program that you have well curated. So thank you for the opportunity. Let me just share the screen. So the points which Pari sir had shared in his previous presentation. I think majority of the points related to needle stick injury prevention has been covered. So let me try and see if I can, not repeat certain points. I will probably quickly go through certain slides. I just have about 5 or 7 slides to go through. I will try and share what I have practiced across while we were working in different hospitals during our journey. So, before I begin, I just have a disclaimer to make. I share some of the experiences during my journey as a quality and operations professional in hospitals. So, if there is any resemblance to any individual or incident, which I am sharing with, it's purely coincidental. The objective of this session, so when I was looking at the topic, I do understand that the focus is on needle stick injury prevention. But a little bit of other safety aspects when it comes to workplace safety is also something that I have covered on. And basically, how do you manage these workplace safety concerns that are identified? And what are some of the best practices which different healthcare organizations look at? So that is what we will be covering in the next 7 to 8 minutes of the presentation. So, healthcare, of course, hospitals can be a very dangerous place for all of us to work. So often we feel that, we are well protected, we have the required resources in healthcare in order to go forward with carrying out our expertise or whatever services that we have to render. But, is our organization really safe or is it not? This is a question that we all probably need to have, on an everyday basis. Because when in the previous presentation, which Pari sir had actually spoken, we all understand that needle stick injuries are preventable. In fact, most of the organizations provide us with the adequate resources to prevent these injuries from happening. But are we doing what it takes to make sure that the safety is implemented at the ground level? That is something that we need to introspect and find out if we are doing it. So on a broader perspective, to understand if in terms of we as nurses or we as healthcare personnel, to understand what are the different safety concerns when it comes to healthcare. Broadly, you can say that, number one is, of course, the needle stick injury and your exposure, blood body fluid exposure is a high chance or a high risk factor that we are all prone to. And of course, there are physical risks when it comes to, say, long standing jobs that you're doing. There are chances that you might be lifting out a heavy patient. So the risk of carrying heavy objects or, heavy patients is also a physical risk that we are posed with. And sometimes your alarm fatigue when you are posted in your high risk areas, that is also one of the physical hazard that you are prone to. Infection exposure, of course, in fact, during the pandemic, COVID pandemic, we all realized that none of us are safe. And, it's very important that we try our level best to minimize the infection exposure. And how is it that we can practice specific measures within our hospital to ensure that the infection infection spread is prevented. And the very important thing when it comes to workplace safety, which could be an impact of what we have undergone because of a needle stick injury or probably an exposure to any other infectious agent, could be our stress, our psychological risks that we are more prone to. That which I think is a very important factor which comes into play, especially when it comes to our behavioral aspects also. Like once you are sure that your place is safe enough to work, and once you are free of any stress at work, that is when you would be able to give in your best and ensure safety issues are implemented at the ground level. Of course, there are risks related to chemical exposures, especially people who are going to be working in your, say, chemotherapy units. There's going to be fumes that you're going to be exposed to. So, risks associated with drugs, their chemical exposure are also there. And sometimes for people to even practice hand hygiene becomes a pain because some people might be allergic to the hand rub solution which is available. So the chemical exposure also is one of the risk factors, I would say. Of course, there are other factors in healthcare which we could consider as safety concerns. Like say for example, your fire related issues that you could have, your disaster preparedness in case you don't have a very strong disaster response team. And probably in recent developments in healthcare we see that a lot of female staff are also being exposed to a lot of inappropriate measures by other people. So such concerns are also these days included as part of workplace safety. So that's just a little bit of an overview in terms of what workplace safety is about, and how organizations needs to manage is what we are going to be looking into in the next slide. So like what the previous speakers had spoken, be it your needle stick injury or any of the risk factors in your organization, what is important is for you to understand what really could go wrong in your organization. So, for that, the organization needs to have a risk mitigation plan. You first will have to identify in terms of what are the potential risks that you might be prone to, depending on the kind of workers that you have, depending on the kind of infrastructure or the facility that you have, depending on the type of patients that you're dealing with. What are the potential risks that we could be facing with, and how is it that we could mitigate these risks? This is something that you will have to be looking into as a first step towards managing the safety concerns in the organization. Of course, the use of appropriate PPEs is very important when it comes to protecting oneself at workplace, especially with regards to healthcare. And availability of appropriate resources, including your vaccination. In fact, while I was going through the topic, the focus in terms of preventing a needle stick injury is what is very important. So the availability of appropriate resources at the user end is very important. Like in the previous session, Parisa kept insisting on the need for having a safe disposal mechanism, like you having a sharp disposal container. But having a sharp disposal container at the end of the ward is not going to solve the purpose. How is it that you're going to be making it accessible to the ground level staff? So availability of the appropriate resources at the right time is more important. That is something that you need to be looking into. And post exposure, what is the mechanism that you have in terms of how the staff needs to reach out to the appropriate infection control nurse? What is the mechanism by which he or she reaches out for help? Does he or she have somebody to talk to? Does a physician probably evaluates the staff? So these policies, these specific escalation matrix should also be defined as part of managing the risks within the organization. Then comes your workspace design, especially when you're looking at the physical hazards of healthcare, and even say for example when you're looking at your needle stick injury prevention for that matter, designing your nurses station, designing the place where you dispose your sharps appropriately does matter. While you are planning for each of these locations in the hospital, making sure that there's ease in accessing the specific area for disposal. There is adequate space where people could move without harming or injuring the other person. All these should also be considered while you're planning for the workspace. Very important is the next step where I have listed out as the buddy system. So, I mean, healthcare organization, especially the nursing wing, the nursing fraternity is going to be like, the majority of the people who are going to be the part of the healthcare system. So, when it is even more important that they have the required support system in place. How this support system is going to be working will be, walk the talk is what is more important. So, a lot of training measures can be in place. You might have a brilliant ICN staff who keeps insisting on there's no recapping. They might be insisting on how the single hand scoop technique works. They might be insisting on the sharp disposal manner. But whether it's going to be implemented by the ground level staff, it will only be implemented when they see their seniors who are going to be practicing what is being taught. So the buddy system works in such a way that it gives the juniors or the staff in the ground level the support system in order to ensure that whatever is trained or whatever is the best practices that has to be followed has to be implemented. So what we do as seniors in the system will be followed by the juniors in the system. So having that culture set in is very important, because that's how it's going to impact the behavior of the people who are going to be working in the ground level. Of course, with regards to how other workplace related safety is going to be looked into is, of course, having the adequate resources in terms of the manpower, making sure that your staff are not overworked, having the appropriate staffing done based on the acuity based staffing. So these are some of the ways by which you can manage these risks. Okay, just a few best practices that probably many of the other organizations are also doing, but just some of the best practices that we follow across our group. Of course, no recap is a policy decision, and that is something that we keep insisting on. And this is more seen in terms of how the seniors or the in charges or the nursing officers are also promoting it. Once they practice it, we see that it is going to be practiced by the ground level staff also. Yes, safety engineered devices are something that bigger hospitals do go for it. So if as an organization you are able to provide the same to your team, I think we should still go ahead with it to ensure that the needle stick injuries are prevented. Sharp disposal, very important. Making sure that the adequate number of sharp disposal containers are available, and making sure that it is also accessible at the point of where the sharps are going to be generated. Here, I would also like to add on one other point. So often, during the practice, we see that the sharps are not just generated by the nursing staff. We see that it is going to be generated by other healthcare personnel, like say your surgeons, your clinicians who are going to be involved in the care at bedside. So in that case, with the help of the medical services and with the help of the senior nursing leadership team, it is always better that we empower our nurses to say that whatever sharps is being generated at the bedside as a waste be disposed of by them only, rather than passing it on to the other person for a sharp disposal. This is something that we need to keep encouraging people on. So this will happen gradually as you tend to have the seniors in the organization who probably speak up and pass on the information to the clinicians. Once a practice or a culture sets in, you will see that gets into the habit, and you will see that people start disposing of the sharps as and when it is generated. Of course, the use of appropriate PPEs is very important in protecting oneself, as well as ensuring that we do not spread the infection to the others. So often we see that organizations do provide PPEs, but whether those PPEs are being adequately used or appropriately used by the staff is another question. This again is going to be a check that you will have to have in a system or a mechanism by which you're going to be ensuring that the appropriate PPEs are being used by the staff, and whether there has been any concern related to the use of the PPEs too. Because what we often see is People are not comfortable using a specific type of mask. People are not comfortable using a specific type of gloves while they're handling patients. So for these, we probably need to be having a mechanism by which we get feedback from the user end in terms of how the PPE has been. We have to probably give this feedback to the central purchase team, find out if there is any concern or any reasons why you probably need to be changing the required PPEs also. Facility support, like what I had spoken in the previous a few slides ago, I did speak about infrastructure wise, how safe can you make the workspace in order to ensure that there is no crossover whenever people walk in, to prevent the sharps injury from occurring, or what is the level at which you have your isolation facilities available in order to prevent the spread of the infection. So these are some of the facility supports that as an organization one needs to be looking into. Uh, Beyond needle stick injury, there are some other safety aspects that I thought we should be looking into, we should be addressing when it comes to nurses. A lot of times, related to the shifting of patients, how safely are we doing? Are we going to strain our back while we are shifting out our patients? This is something that we can actually look into, where you have patient aid transfer slides, which most of the organizations are probably doing it. So there is an appropriate technique that you need to be following while you're shifting out a patient using this transfer slides. So this is also something that you could be looking into. This is a very innovative thing, the magnetic sweeper, which I thought I will just share, which was a brilliant idea which came up from our housekeeping team. So we keep talking about the safe disposal of sharps. We keep saying that, at the source we dispose of the sharps. But it's not that, 100% of the times that the sharps reach out only to your bins. It doesn't always reach out to your bins. Probably there are instances when the sharps are lying bedside. Probably the sharps have been found near the common biomedical waste storage area. So in that case, one of the suggestions which came in as a brainstorming idea from our team was, our mop sticks. The sweeping mop sticks that we use for the flooring. So it has a magnetic strip attached. So it actually helps to make sure that any of the metal particles which is found downstairs, which is found on the floor, it gets stuck onto the magnetic sweeper. So by doing this, for us to directly touch the sharps is also going to be prevented. And though the nurses are not going to be directly coming in contact with the sharps in this common biomedical waste area, this is definitely going to prevent an injury from occurring. Just in case, they are going to the common biomedical waste area and they happen to get injured. Things like this could be innovative ways of preventing it. So this was something that we came up with, but very we were very glad to know that this idea came from the housekeeping team and not necessarily somebody who's directly involved in the sharps generating area. So I think one of the ways by which we should be looking at best practices in needle stick injury prevention, or even with regards to any safety measures to be implemented, is by involving even the non-clinical staff for their input. So they could have a lot of innovative ideas. Of course, when it comes to the infection prevention spread, so post the terminal cleaning of these isolation areas, or whenever we have an infected case admitted in the hospital. So post terminal cleaning, we have the UV tower, which is also being used in certain areas of the hospital. So depending on the square feet of area that we are trying to cover, the duration of the UV light treatment is also being decided. So this is also these are some of the best practices that is being followed across the group. Of course, there are other measures of safety when it comes to what we do with regards to ensuring safety for our nurses. Organizations needs to look at other aspects of safety, like your fire safety, how well your organization is prepared for disaster preparedness. The safety of women at workplace is a top priority. So what we would say is, in fact, even before the just when the Kolkata incident did happen, we had our leadership team who had worked on the way that how the safety of women at workplace can be ensured. What is important is in this pink book or a guidebook that was shared across the group, Each of us were made aware in terms of how we can ensure our own safety, and also how the other fellow colleagues who are male colleagues who are working with us can help us with the safety at workplace. So these are some of the other best practices. Now, specific to the role of nurses with regards to the workplace safety. Training is what we keep talking about. So training on what? More in terms of you need to encourage the people from attending the training, and also ensure that what they have been trained on, whatever is the best practices that they have learned, has to be implemented in the ground level. That's where walk the talk concept comes. So what you are going to be teaching or telling your ground level staff is not something that they are going to follow. They will only follow what you practice. So that is a very important step. Second comes your encouraging of reporting. In fact, the first poll question which Stella had asked, I'm glad that everyone had a thumbs up, and I didn't see many emojis which said, they have not reported. Very important, unless people start reporting needle stick injuries, unless people start telling that this has gone wrong, you are never going to understand what really has gone wrong, or you're never going to improve yourself. So encouraging reporting is very important. And based on what has been reported, you will have to be looking at specific interventions that has to be carried out. And then comes supporting and planning of departments. Okay, this I found it as a very good practice in our hospital. Of course, for hospitals which are probably decades old, it is difficult when you are going to be making changes in the existing setup. But however, if you're planning to look at adding a new department in your hospital, or if there's going to be a new hospital which you're going to be opening, having a nursing representative to be part of your project planning phase definitely paves way. Because at our hospital, some of the new hospitals which we have planned, what we do is we have the respective ground level. I mean, in fact, we have senior nursing members who are part of the project planning stage. They are members who have had ground level experience. So they tell us in terms of how useful, or what is the place at which they prefer to have their sharp disposal area to be planned. They tell us as to where they need to have the hand rub stations placed. They tell us in terms of what is the level at which the storage space has to be. They tell us in terms of what is the specifications in terms of what needs to go when it comes to the specific requirements for a certain department, specific to the nursing angle. So this is going to be making sure that your nurses are being involved at the planning stage. And definitely the ground level implementation will also be better as and when you get them involved in the earlier stage only. And sustenance of practice of whatever is the good thing is only going to be when your nursing leaders and the in charges practice it. It is never about what you say, it is only about what you practice that is going to be looked into. And one last bit that I thought, especially when it comes to needle stick injuries or even other physical hazards which nurses are prone to, these days healthcare is never about within the healthcare setting. So within the hospital setting, you can ensure that you have the appropriate PPEs, you can ensure you have your sharp disposal container. All those can be ensured within a facility. But when you are going to be extending the care beyond hospitals, when you're going to be looking at care in a probably a home setting, so what is it that you do to ensure that you have the required resources for your staff to render the care? This is also something that we have to be looking into, because these days I'm sure healthcare is not just confined to the hospital setting. We need to go beyond the hospital setting. Lastly, the sustenance aspect. As an organization, you need to have an appropriate policy on workplace safety, especially with regards to needle stick injury prevention. Have the relevant stakeholders involved while you're developing the policy. Train, keep training people, because that is what is going to eventually bring in the behavioral change. Not just stop at training, check for the implementation at the ground level. That's how you evaluate the effectiveness of a training. and you need to review and revise. So depending on the kind of incidents that gets reported, depending on why a needle stick injury has occurred, depending on the root cause analysis that you have come up with, you might want to revise the policy. You might want to go back and revamp the way in which you are doing a certain thing. So you might have to review and revise as and when required. And recognition of good practices, just as what Pari sir had spoken, you will have to recognize the staff who's probably been doing a good job and who's not had a needle stick injury for a very long time. You could have a periodic review in terms of when the last needle stick injury has been reported, whether there's been an appropriate change in the practice by the specific staff. Give a recognition for the concerned staff, because this is what is going to be helping with the sustenance component. And lastly, how organizations can ensure sustenance is we have, being a corporate hospital, we always have, a certain monthly compliances report that we keep tracking. So needle stick injury is also one of those requirements that we track on a monthly basis. But this data will be validated, or it's going to be reviewed on a biannual basis by an external agency. That's more in terms of a second party audit, who will be doing the audit on behalf of Apollo, but from a different person will probably come into a unit and they'll be reviewing it. So what is the level at which these incidents have been reported, and what are the specific measures or actions taken whenever a needle stick injury has been reported, and making sure that there's a learning from each of these incidents, and doing an appropriate corrective action and a preventive action is all checked as part of the audit process or the compliance audit process. So these are some of the measures by which you can look at sustenance. So lastly, we in healthcare, we keep asking, is it safety first always? Yes, the answer is it's safety first, but what is important is safety starts with us first. So we have to ensure safety at our level, and only then we can ensure patient safety across the organization. I will just see if I can share this checklist, because this is a very good read for all of us. JCI had released this healthcare worker safety checklist. You have a detailed checklist where, from the administrative side, how can you ensure needle stick injury prevention? From the nursing staff level side, how can you ensure needle stick injury prevention? Infection exposure, how do you prevent? So all these are some of these things which are listed out as part of the JCI resources. So let me see if I can attach the document and leave it in the chat box. Even otherwise, you could download this from Google. It is readily available. It's a free text which is available. So thank you for the patient listening. Over to you, Stella or Pari, sir.
Thank
Thank you.
you.
Yes, sir.
You can take over. Yeah.
Yeah. Thank you so much, ma'am. Thank you so much. And there have been heartings in the no, chat box today, rather than on the screens even. And even they like your that the mop sweeper, about that you were talking about the mop sticks. They were like multiple comments saying that like it's very interesting like that and all. So thank you so much, ma'am. Really very insightful. And I have shortlisted a lot of questions, sir. So it is, they were from the YouTube and from the from the comment box and also from the Q&A sessions. Can we go ahead with the questions?
Yeah, please.
So meanwhile, before getting into with the Q&A session, there's a link posted in the chat box. Okay, so please click that link and then fill the form, so that after 48 hours of time, so you will be getting your certificates. It may even take another 4 days, because the number of participants participating for this webinars are huge. So it takes time technically to send it across. So thank you so much. Ma'am, you have shared something in the chat box, the PDF. Yeah.
I think the document is, Vidya has posted in the comment as well, the PDF.
Yes.
Anybody wants, they can download that.
Okay. So can we start with the questions, sir?
Yeah, please.
Yes. Okay. There's a first question asking, like Miss Revati, like she have asked, like, hospitals having NSI mostly while cutting the needle in the needle hub cutter, can we discard the needle directly in the sharp container?
See, again, that's a call that you as an organization will take because some organizations do not have the needle, the hub cutter policy in place. They would just directly dispose off in the sharp disposal container. But again, some organizations do practice the needle stuck, I mean, the hub cutter model. So this is a call that you can take after discussing with your infection control team. I mean, your infection control committee, if you have one in your organization. So that's a policy decision.
I think purely from Vidya, from pollution control board point of view, they don't insist
They
this.
don't insist. They don't insist. But there are organizations which do. It's a though pollution control board doesn't insist. We just dispose of the sharps as such. But there are organizations which practice. Yeah.
So I think your policy should be based on your pollution control
Yes.
board guidelines, and
Ideally, yeah.
unnecessarily it exposes people for handling the needle more. So upcutters, I think, better to avoid them. But as we
Mm.
just said, no, you need to make it as a policy in your
Yeah,
hospital.
because more often what happens, sir, these are decisions which some of their committee members will decide. So I think it's
Yeah, yeah.
always better you route it through.
But I think in this forum, no, we just talk about evidence
Yeah,
and
sure.
bother about individual hospitals.
Yeah.
That's one advantage Skills Summit has got. No, we're not relying on any particular hospital, so we can bravely say what is right and what is wrong.
It's not mandatory.
Yeah,
I did share the checklist. I think some have asked for it. I think I did.
yeah. What happens is when they keep telling
Yes.
comments, it keeps going up. So, but no, we will put it in the WhatsApp group. I
Okay,
think
sir.
that as well. Yeah.
Okay. So the next question is about this is from Miss Shubha Bharati. So, is there a specific duration for storing PP containers, punch-proof containers, after opening to use or discarding the shops?
Okay, so once the sharp disposal container is three-fourths full, we generally close it and then we discard it because we don't wait for the sharp container to, get overloaded or if the sharps are exposed outside. So what we generally, the practice that we follow is once it is three-fourths full, we lock it, we close it, and then we discard the container. So that is the ideal practice here.
Yes, yes.
You don't have to let
This
it
is one
overflow.
question actually I was asked in a small center. In a low
Okay.
volume center, it takes a long time for the puncture-proof container to become three-fourth full. So they were asking, how long should we actually, keep it? Should we discuss? Is there a specific time frame? And I searched for it. I couldn't find anything, on that.
In one of our smaller centers, we were having a discussion with our infection control doctor consultant. So there's no timeline as such. We only insist on the quantity reached. Doesn't.
Okay, that's really, a good clarification. Yeah, thank you.
And there is another question. It's about what is the follow-up schedule after needle stick injury?
This is about what?
It's about like I think they're asking about that, including the PEP
The
after once
post-exposure
the needle. Yes,
prophylaxis.
yes, yes. Once the needle stick injury have occurred, like what is the follow-up schedule?
Okay, so of course, the day when the needle stick injury happens, that's at level 0. They are going to be having a specific follow-up. I mean, the check that has to be done with the infection control team. That's at 0, 30, and 3 months is what we follow.
Yes, yes. And okay. Another question. So this is related to, I think, from the from the operation theater side. They have been asked. One question is from Ms. Janita Vagila. How to handle IONAM needle to prevent NSI, which is used in neurosurgery?
It's intraoperative active needle
Yes. Yeah,
stimulation.
active needle.
Yeah,
Yeah.
Vidya.
I
So
I am not too sure about this.
These are
I
very
can, yeah,
fine.
I can answer for this if you would okay for it. Like, that's the needle with the
Please.
K. So what you have to do, preferably, how you handle the scalpels in the operation theater, the same way. Even though it's a cable, you cannot handle in the no with your hands. You can use the forceps to hold that and hand over to the surgeon. And also while no passing over that needle, you can face the needle towards you, not to the person who is like going to get that. The same protocol as you handling the scalpel. So that is the best method for it. And after use, most of the hospital they have the blunt tip to cover it up, but you have to put it in the kidney tray and handle it safely. That's it. So it's almost like a scalpel how to handle it. So I have handled this. So
Yeah, Stella in her previous avatar was an OT nurse. So
and there is another question related to the same thing. How do we dispose true cut biopsy guns and trocars since it's in bigger size? So the biopsy guns and the
get
trocars
a
what
bigger
we use.
bin. That's it.
Yeah. So it will not get inside. So as for this also, as a theatre in charge, I have seen nurses who try to put that fit into that puncture-proof container where the puncture-proof is like entirely get messes up. What you have to do, you have to tell to your organization. So what I did personally, Alsha, you can do the same thing. This is the question from Miss Kolande Teresa. You can ask your organization to get the bigger puncture-proof which fits that true cut and the biopsy guns, which is specifically for that. So you have to create an SOP where that particular that dispenser is used only for that kind of bigger size of sharp no equipments, not for other normal syringes, because usually they'll mix up. So is the regular containers for the syringes, no, the needles, and the bigger size ones you can accommodate in the theater for the true cut biopsy guns and the trocas. I think it's fine, no sir. So this thing they can do it up.
Yeah.
Yeah. Yeah, so there is one question related to the challenges. Like a biomedical disposal facility does not provide a smaller punch-proof container to be kept in procedure trays. Any ideas regarding the same?
Vidya, take it first. I will tell you some jugad after that.
Okay. So it's tough. Yes, it's a very costly affair. So not all can afford, the bigger, I mean, the puncture-proof container at bedside. But however, there are other measures that we do take in. So we do have, when we reach out to our local stores people, there are few smaller bins containers available, which are strong enough to ensure that there is no it's still puncture proof, but not the way it is for the usual disposal mechanism. But we use those as the bedside. So the smaller, the white bins, which are slightly cheaper, is also something that we look at in the local market for
Yeah,
bedside.
this is right from your local store. That's
Yes,
what.
local stores, sir. Yes, sir.
Yeah, there are some thick
Not the
plastic
branded ones. Thick plastics are available, sir.
bottle
Yes, sir.
with a
Yes,
narrow mouth.
yes, yes, sir.
So
Yes.
you use that in your, and but you label it as sharps very
Correct, sir.
clearly, and maybe you can even put a biohazard sticker on top. So these are all innovations which you need to do, and and also some hospitals use the IV bottle.
Mm.
Use the IV, no, the thick IV
Yes.
bottle, and then cut the top of the neck and use it as a puncture proof at the along with the injection tray or IV tray. I have seen one hospital using that. So if you don't, if your management is not giving you money, you need to think outside the box.
Okay. Okay.
Yes,
So there is another question. Like both of them have asked a similar kind of question, but it is like Miss Sahina Hamid have asked like single hat scooping method not regularly recommended. Is that so like that? And Miss Deborah have asked how the understanding about when all can we use the one hand scooping method. So more or less the question is like same.
Yeah.
Yeah.
Um, can I take it, Vidya?
yes, sir. Please go ahead.
There is one principle in quality. It should be like all your policies should be very straightforward, and there should be no exceptions to the policy. So that's the reason no recapping. Okay, if you give any exception to the recapping, then people will use that. So that is, really, if you look at it, the answer which to that question in terms of the ideal situation. So no recapping, period. No, don't talk anything more than that. But
Yes.
but the cost factor is there in India, and we all know have to face that. So these safety device needles, are almost three times more expensive than the IV cannulas, And so these are sometimes which many hospitals cannot afford. So if you look at the statistics of our hospitals, even today 60 to 70% are run by less than 100 beds. Our whole healthcare system runs on small SHCOs all over India. So how many of them would want to do that? So because of that only we are saying, if at all you allow recapping in your hospital, please teach them one hand recapping. And this is mainly for IV cannulas and other bedside IM needles, insulin syringes, which comes with a cap. So, but more better than that is giving them the bin at the bedside, so that they don't, so that still you can do no recapping. So, which is also quite a cheap method if you can innovate and not use those imported small bins. You can still do that. So the answer to that is no recapping is the best. And
Yes.
if you are telling yes, I'm allowing, then please train them on one hand recapping.
True. Okay, sir. And there is another question, like certain hospital practice refilling the hydrochloride solution as per local agency recommendation. Is it
Yes.
acceptable?
I think after the revision of the Pollution Control Board, I mean, the biomedical waste disposal, they do not insist on the use of
Yes.
sodium hypochlorite.
Yes.
But again, just like how we spoke about the needle cutter, the hub cutter, these are practices which some organizations are comfortable doing. But as per the requirement, it is not a need.
Yes. Truly said, ma'am. And it is not as per like CDC guidance, OSHA do not say like we have to fill it with a hydrochloric solution and
And even
heavily for the cross
that is
contamination also.
there's a problem with vendors also. These
Yes.
are all very practical things, no? I mean, the pollution control board doesn't say, but the vendor who's taking it from the hospital will insist that the hypochlorite has to be there. So then what do? You have to, do that. So these are all very lot of variations which happen in our hospitals.
Okay. So they want one suggestion from you. So it is like Mr. Abdur have asked, can we cut insulin syringes in spite of directly discarded in the punch-proof box to reduce the number of boxes which is taken in the unit?
Sorry, I didn't get that question.
So he is asking, can we cut the insulin syringes alone? So because I think they are discarding the insulin syringe itself with the needle into the punch-proof container. So he's asking whether can they cut the needle and then discard for the insulin syringe alone, so that it will not fill it up faster, so that they can reduce the number of boxes which is utilized in the unit.
Again, see, if resources is a constraint, that's a call that you need to take, I mean, on a case-to-case basis. But it is not mandatory to cut.
I think the more you handle those things, the more chance of injury. That is the logic.
Yes. Yes.
So that's why they're saying just dispose it. No, why are you saying keep it at arm's length and dispose it? So don't handle it too much. So which is again that's what you have to look at. I think Stella, there are a few raised hands. You want to see whether they want to ask, unmute and
Yeah,
ask.
sure, sir. Sure. Have you given the permission? Yes, who all have raised your hands. The permission have been availed to you. You can unmute yourself. I'll call out the names now. Okay, Miss Anjana Manoj.
Hello.
I
Hello. Yeah, hi, ma'am. Good evening, sir. Good evening, ma'am.
Good
I
evening.
have one doubt. Like you showed that for the housekeeping, they told that the broom which is being with the magnet one. But then, if it is so, how would you brush off the needles that has been stuck on the means on the broom? And if so, are there chances of needle stick injury? When you were saying that, I thought that there would be a chances of needle stick injury would be high.
Okay,
So
because while
yes,
they try and remove it.
yes, yes, ma'am.
It's
So
actually a strip, so they just have to take it and just discard it from the edge. It's a strip.
oh,
They don't have to
okay.
directly touch the sharp object.
Oh, you mean the strip can be removed off?
Yes, yes,
It
yes.
can be peeled off,
Yes,
right?
yes. Yeah.
Okay, okay. Thank you so much, ma'am. Thank you.
Okay. The next person, Subha Bharati. Miss Anjana Manoj, you can mute yourself now. And Miss Subha Bharati. Okay, she have put on her hand now. Okay, Miss Seema Nikalji. I think I'm reading out the names. They're putting down their hands. It sounds like I'm taking an attendance. Okay, Miss Sainab Fatima. You want to ask something? Yeah.
Hi, good afternoon, everyone.
Good
So,
afternoon.
my question is, as an ICN, what is our responsibility if the staff hide the incident? Because for us, it's a big challenge. Most of the incidences will not reported. So, what could we can do to reduce it?
Uh, sir, can I just share my points and
please.
then you can add on, sir?
Yeah.
So, honestly, I think this is more in terms of a culture that we set in. How is it that we encourage the staff to report is something that we have to develop gradually. So, only when they feel that they are comfortable to share the information would they probably come forward to, start reporting the incident. Again, the practice of how we walk the talk. So, as soon as an incident gets reported, how do we handle the situation is something what it's going to encourage or discourage the others from reporting or not reporting. So it is more in terms of how you encourage people to start reporting by the way you handle, I mean, you in the sense how the team actually handles whenever a needle stick injury is reported, and probably start encouraging the teams whenever there are near misses which are going to be reported. Start something small in terms of recognizing the teams which have reported more number of incidences or ways to prevent a bigger incident from happening. So when you start encouraging people to report a near miss event, they will eventually be open enough to say whenever an incident actually occurs. So that's my call, sir. Sir, over to you.
Very, very true. I think, I would fully second what Vidya said. It's the culture. And wherever I keep, going of giving these talks about quality, this question comes up. I think Vidya must have the same experience because she also travels a lot to, give these talks on quality. Unfortunately, it is our culture, and this culture has been there right from school. So, when we make a mistake, well, there is no question. The teacher punishes us, right? So this punishment culture is there in every organization, and healthcare is no exception. So when we do a mistake, we want to hide it because if we tell that I made a mistake, I'll be punished. So how many hospitals have overcome this culture? It's a very, very difficult thing. However much the leadership tries and what all the education you give, the middle management, there will be several people who would just jump on the person who made that mistake and shout. And one incident is enough for the rest of the staff to keep silent and not report. So that is the problem, as ma'am, as far as I could, and it's very, very difficult problem to overcome. So please know that is, as an ICN, there is little you can do. You try your best, you try to motivate your staff, but the organizational culture, are they punishing people if they make mistakes? If that is the case, you'll be it's a very difficult job for you.
Thank you so much, sir.
Yeah. So there is another person, Titisil, Miss Titisil. Okay, Miss Sainab. Okay. Okay, so can we move on to the Q&A portal?
Yeah, Shanti Radhakrishnan is a new one, so we can try, then we can move.
Yeah, okay.
And I think we're running out of time, so I only 10.
Yes, yes. Yeah, can we move on with the Q&A portal? So there are some
Sure.
few
Okay.
questions are there. Yeah, okay. So Dr. Saravana have like Titisel, do you want to ask something?
Yes, yes. Yeah.
Yes.
Questions are there. Yeah. Okay. So, Dr. Saravana,
Okay, can you mute everybody except Dr. Pari and Miss Vidya? Mute all.
Titisel, do you want to
I'm
ask?
able to listen to my own audio in the thing, sir.
Hello?
Questions are there. Yeah. So, Dr. Saravana, okay, can you mute everybody except Dr. Pari?
Done? Okay. Okay, sir. Dr. Saravana have asked, like, please tell us about one implementation that was done in preventing NSI that made a
Hello?
drastic.
So,
I think it's a bit of an echo, so it's
Sorry, I only heard one part. One incident?
yeah,
Sorry,
yeah.
one?
Yeah, sorry, ma'am. So he wanted to know, Dr. Saravana wanted to know, is there any one implementation which was done to prevent NSI and it has given you a drastic reduction in number of NSI rates?
I mean, the best practices that we did in one of the organizations where I had earlier worked was having the bedside sharps disposal. That was the first initiative, in fact, because initially they were very hesitant to even have one common sharp disposal container. And what we found was after having a sharp disposal container, which was like required mandatorily by the law, but then post that, having an implementation at the for the bedside disposal was one thing that we were able to get it done well. So that I would say is important.
Okay, okay. Thank you, ma'am. Thank you. And there is another question like, how can we prevent insulin pen needle stick injury?
Safer handling is what I would say, but I don't know if there are any other practices that probably Pari sir, you can answer it better.
Yeah.
I don't know. I mean, we discard it as such, and that's all
Yeah,
we
I
do.
mean,
We
you're
don't
asking
recap it.
preventing injuries is the same,
Yeah, it's the same
Same
only.
thing.
We just any
it's a
other
sharp.
sharp. Yeah, any other sharp that you handle. That's how.
I'm not aware of any special precaution.
There
Nothing
are
specific.
retractable needles have come for the insulin pens.
Yeah. Again,
Even you can,
engineering, same
yes,
like
it's all engineering control. You can just, but as ma'am and sir have said, you have to use the precautionary method while handling the needle. Needle is needle, same wherever it is. Okay, and okay, how to prevent needle stick injury during ABG sampling? I think all the questions are related to the same things. So I'll just quickly run off the others. Any other questions which is very different? Mm,
I think there has been one question. I think whether we have not been clear, we have to clarify this. I think Shanti Sagal, okay, talking about diluting medicines.
okay.
I mean, you can't be, no, she's saying can be, how can we
What
not?
to do? Can I read out, sir?
Yeah, please, yeah.
What to do? Like what to do instead of recapping a needle when diluting a medicine and then have to administer via cannula. So because when we have to administer through cannula, we have to put needle aside and for which we have to recap the needle again. What to do then?
Yeah, it's the same. No, like
It's the
if
same,
you
yeah.
have the money, you just dispose a needle, pick up a new needle, right? Every time you take one needle for drawing and then one needle for diluting. So that is what is done in the West. They say don't recap. But if you don't have the money, use one hand recapping. This is what I explained to you. So
Yes.
you have to recap because you don't have enough, your organization or you don't want to waste resources. So then you need to train all of your staff in one hand recapping. So this is a very very typical instance where one hand recapping is very useful in dilution. So if you take the operating theater in the morning, the anesthetist will keep uh, loading syringes into from several ampules, and each time they have to recap, and you need to have the do the one hand recapping. And also, if the needle has to be discarded, have the sharps bin nearby. These are the two things which you can do. So, the same explanation, and because your question was there, I thought we will repeat that because maybe we didn't explain it to you properly.
Okay. Done, sir. Another questions is like same thing.
Is Dr. Shanti Radhakrishnan still there? Because I don't know if she had her query answered. Dr. Shanti, I think it's okay. Maybe she's.
I think she's. I don't think she's there.
Yeah.
Still there.
Okay.
Still there.
And someone who asked.
Sorry. 1 minute. Vidya, what did you want to follow up?
Shanti ma'am had something to ask. Yeah, I think she's just texting. She's just
She
messaging.
can unmute. No, she can talk now. You can unmute yourself and talk now.
Shanti ma'am was a colleague earlier, so I just
Mhm.
wanted to hear from her.
Okay. So please unmute yourself and talk.
You have given the access, right? Yeah. Please unmute it also.
Shanti ma'am, you have something to say?
Yeah, Shanti ma'am, you have unmute yourself already. You can, ma'am, you can ask here. Okay, can you share the safety checklist? That's the thing.
Okay. I think probably Stella, you should share the PDF
No, that
file
is
in
from
the group.
Shahina. I'm sorry. Shanti madam, sir, I have unmuted. But I
No
don't
problem.
know.
I'll take it offline. I'll call
Okay.
her. Okay.
We can hear you, madam.
Yeah, yes.
Yeah.
Talent is one of the like some have asked like can we get the recorded version? Yes, of course. You can know you can follow our YouTube channel so that post sessions you will get all the videos there over. Then you can obviously you can have.
All our webinars are recorded, so please visit.
Yes.
Yeah. All right.
Yes, sir. Yes. Yeah.
Um,
YouTube channel name is Skills for Med.
yeah, it's behind me. Can you see the name behind me?
Yes.
That's the name of the channel.
Yes.
That's the
Thank you.
maximum marketing I've done for this, I think.
You will get all the recorded version, all the webinars are recorded. You will get all the sessions without missing anything. You can catch it up there. As because many of them, like after attending the session, again you want to refer it back, something you have any query, you can easily go and get the things done by logging into our YouTube channel. So thank you so much. And also through your mail, you will get the WhatsApp link where you can jump into our WhatsApp group so that you will get regular updates about Skills for Med courses. So that is thing about we have made all the process very easy. So thank you so much. Thank you so much, ma'am. Thank you for your time. And you have been like with a smiling face from the start till the end. You were with the real patience you were explaining to everybody. Thank you so much. And I think your interesting thing today they have taken away. I think everybody will be tomorrow going into the organization asking for that the fancy mob which you were talking about.
Is it available commercially or is it
So
something?
we made it. You could all try. I mean, magnetic strips are available. You could just include it as
Just buy
part
those
of it.
magnetic strips and put it onto the mob.
Yeah, this is an out of the box thinking by our
Yeah,
housekeeping
it's
team.
very, very innovative.
Yes. Yes.
Especially in the biomedical, the storage area. There's a lot of needle stick injuries for the housekeeping. So this is really very useful.
Yes, sir. We have come to an end.
Over to Mr. Rajaraman, please.
Yes.
I think we overshot by half an hour. I think people had a lot of issues to talk. I think the practical insight what Ms. Vidya shared was very interesting. So, and interesting innovations as usual of your hospital. So that's very good. So actually, I also picked up a lot of notes. This COMB and ESCA, these are good acronyms which we can follow at corporate also. Maybe that's a good learning which I would also take forward. So thank you all very much. It was really enjoyable sessions. Thank you, Dr. Pari and Ms. Vidya.
Thank you so much.
Thanks, Stella
Thank
and
you.
Jayanti.
Thank you.
Thank you so
Thanks
much,
to all
sir.
the participants. So we'll
Yes.
meet again next week.
Yeah.
Yes.
Thank you, Vidya. Thank you so much.
Thank you so much.
Thank you, sir. Bye. Bye.
Thank you, everyone.
Bye.
So I'll be there. So you both can sign off. I'll be there. So all participants, you can. Yes. Thank you, sir. So dear all the participants, the link is there again. So you can click that link and fill the form. So